Hello everyone, this is Sharmia. In this video, I am going to present about the medication adherence. In this video, we are going to see about the definition, factors affecting the medication adherence, then how to formula to calculate the medication adherence, and role of pharmacist in improving the medication adherence. First of all, what is meant by medication adherence? Medication adherence means, according to World Health Organization, define the medication adherence as the extent to which a person's behavior in taking medication corresponds with the agreed recommendation from a healthcare provider. Medication adherence means checking whether the patient is taking the medication which is suggested by the healthcare provider properly, or whether the patient is taking this medication properly without missing any doses or not. This is the medication adherence. Medication adherence means the patient must adhere to the medications properly, take all the medications regularly without missing any of the doses. This is meant as medication adherence. What are the factors affecting the medication adherence? According to World Health Organization, there are multiple factors which affect the medication adherence. Mainly, there are 5 types of factors. One is social and economic factors, healthcare system factors, condition related factors, therapy related factors, then patient related factors. First is social and economic factors. Social and economic factors means it includes low health literacy. There are most of the in India. Particularly, there are most peoples who have low literacy, so they do not know how to take the medications, whether taking medications will heal the diseases, the importance of taking medications. They do not know about this importance. This is the main reason. Then, without family or social support network, some people will have no family to take care of them. No family will help them to take the medications properly, to buy the medications properly, so that they won't take proper medication for the diseases. Unstable living conditions. Homeless patients. For homeless patients, they will have no money to buy the medications, or repeatedly visit the doctors. They will unable to attend the visit to the hospital, so that they won't take the medications for the diseases. Then is busy schedule at office or at the business. Some people will work in the office, so that they will not have a proper time or leave to take them visit to the hospital, so that they will skip taking medications. They will continue to take the medication until they have that. Without time, they will skip the visit to the hospital, so that they will skip the medications. Then, limited access to healthcare facilities. In some areas, there will be low healthcare facilities, particularly in town areas, village areas. Mostly in the village areas, there will be low healthcare facilities, so that the people will avoid taking medications, because they can't reach the medications, medical hospitals firstly, so that they will skip taking medications. Then, inability or difficulty to access to the pharmacy. Yes, some people will have difficulty. They will be diseased conditions. Some people, if they have low family support means, they can't take the go to the pharmacy by themselves and take the medications, so that they will skip taking the medications. Next one is high cost of medications. Yes, cost is the major factor affecting the medication adherence. Due to high cost, the people will stop taking the medications, stop buying the medications. Next, cultural and lay benefits about illness and treatments. In some culture, they will think that praying itself will heal their diseases. They should not take the medications. In that way, they will think so that they will avoid taking the medications. These are the social and economic factors. In social and economic factors, they mainly focus on the people's conditions, like the hopelessness, inability to reach the hospital, their busy schedule. These are the social factors. Then economic means high cost of the medications. These are included in the social and economic factors. Next is healthcare system factors. These factors of all healthcare includes poor relationship between the provider. Yes, for healthcare factors, we mainly focus on the healthcare provider. Healthcare provider means prescriber and the patient is the main factors. There will be a poor relationship in some hospital. The doctors will not talk to the patient in friendly manner, so that they will some doctors will speak to the patients in angry mode, so that the patient will not visit the uh, hospital. So this is the major factor which affected the medication adherence. Then poor communication. There will be no communications between the prescriber and the pharmacist. This is also one of the factor. Disparity between health belief models of the provider and the patient. And this means health. Yes, there will be a doctor's perspective and patient perspective will be different, so that there will be low connection between their consideration, so that there will be the medication adherence also reduced. Inadequate reinforcements by the healthcare provider, lack of a system to educate both. Yes, some healthcare providers will not properly know about the importance of educating the patients, so that there is not a proper education system for educate the provider to help the provider to educate the patient about the diseases, because mostly the patient will not aware of the disease. They will be unaware about the diseases, so that this is the main responsibility to educate the patient about the diseases will be given to the provider. So some condition the provider also have no proper time to educate about the diseases. In that condition, the pharmacist can play a role in educating the patient, etc. But the major disadvantage is the poor knowledge of the patient about the disease, and the provider is not educating the patient, and it's a proper management. Yes, the patient will not have knowledge about the disease and its management, right? So this is the responsibility of the provider to educate the patients about the disease and the management. A lack of continuity of care also yes, in starting the doctors will give some care to the patient. After time's gone, they will stop carrying the patient, so that not carrying the patient will also stop taking the medication. So this is also one of the major disadvantage factors affecting the medication adherence. Next one is condition related factors. Condition means this is based on the patient condition. First one is condition related factors includes decrease in the symptom severity. Is after taking some medications, after 1 or 2 weeks, the patient will start to the patient condition will start to improve, and the patient symptoms will decrease, so that they will think of stopping the taking the medications. This is all of the main factors affecting the medication adherence. Thinking of uh, the patient himself think the patient himself think that taking stopping the medications, the patient has already cured, and he can stop the medication. This is one of the disadvantage. Disappearance of the symptoms. Yes, disappearance of the symptoms. The people think that they are cured, so that they can stop the medications. Patient with depression. Yes, the patient who are depressed, in depressed condition, who are taking the medication, they will not take the medication properly. They will show low interest in taking the medications properly. A patient with psychiatric disorders, do not remember, yes, psychiatric disorders patients, they need some person to help to remember about taking the medications, or help to take the medications, because they will not remember of taking the medications, or they will not show any interest to take the medications. These are condition related factors. Condition related factors mostly include the disease symptom severity, the disappearance symptoms, patients conditions like depression, psychiatric conditions. Next one is therapy related factors. Therapy related factors, complexity of the therapeutic regimen, treatment require mastery of techniques, yes, injections and inhalers. Some people do not know about how to take the inhalers, or they will feel discomfort taking the inhalers injections, so that they will skip taking that medications. Some is duration of the therapy. It's the duration of taking the medication will be long, so that duration will be long, so that the people might stop taking the medications in the half. Uh, Frequent changes in the medication regimen. Yes, according to the condition, the frequency will change, or duration will change, uh, so that the people himself think of skipping the medications, or they will forget and miss the medication. Lack of immediate benefit of the therapy. Yes, mostly the people will think of getting the benefit immediately, so that lack of immediate benefit will cause the patient to stop taking the medication. The people themselves think that this medications have no benefit, so that they can stop the medications at all. So that this is all of the major factor affecting the medication adherence. Next is medication use attached with social stigma, unpleasant side effects. By taking some medications, people might feel some side effects, like in metronidazole. Take metronidazole will cause stomach discomfort. By causing, if the patient have a mostly stomach discomfort is major uh, problem. they will not show any interest in taking medications if they have any side effects in taking the medication. This is sort of the major uh, the dedication adherence factors affecting treatment interference with lifestyle. Yes, some diseases they lead to adjust their lifestyle also. So lifestyle with the treatment will improve the disease condition of the patient. But some people will not should rest in their lifestyle changes, so that they will skip taking the medications. These are related to the therapy. Therapy means injections. Their injection all are related to therapy. Next one is patient-related factors. Patient-related factors mostly include their patient's conditions like visual impairment. Patient without visual, they can't take properly take the medications. They will with the medications they have. They need the support to take the medications. Hearing impairment also same. Cognitive impairment, they will not show interest in taking the medication, so that they need a support to take the medication. Impaired mobility, yes, mobility, low mobility means they can take the medication, right? They need a support. Swallowing problems, swallowing problems condition patients, they will not take the medication because they will have pain in swallowing, like that problems, so that they will not show interest. Poor understanding about the disease and benefits of taking the medications. Yes. Most of the people have no knowledge about these conditions and their benefits of taking the medication, so that they will skip the medications. This is the major factor affecting. Inadequate motivation from the healthcare providers and family members. Most of the people, the family members will not encourage the patients to take the medications, and the healthcare providers also will not encourage the patients to take the medications. So that this is also one of the factors affecting. Fear of adverse effects. Some people will get fear about the adverse effect if they will get an adverse effect in taking these medications, so that they will skip the medications. Psychological stress, anxiety, anger, these kinds of patients will also avoid taking these medications. These are related to the patient-related factors. Next one is formula to calculate the medication adherence. Percentage of medication adherence is equal to total number of the actual doses of the patient has consumed since last appointment divided by total number of the calculated doses to be consumed into 100. For example, the patient should take 100 medicines means 100 is the total number of the calculated doses to be consumed. Until this appointment date, until today, he can consumed 30 out of 100. Means 30 divided by 100 into 100 is the percentage is medication adherence. Still now. Then role of the pharmacist. What are the roles of the pharmacist in improving their medication adherence? Pharmacist is can work with the patient in removing the health system related factors. Yes. Pharmacist can help the patients about saying the importance of taking the medications. They can help the patient. They can work with the patients. They can travel with the patients. Like that. But the major barrier of the patient's non-adherence to their medication is lack of belief about the usefulness of the medication, the management of the diseases. The major problem is that the patient will not know the importance of taking the medication, the importance of their disease, the importance of curing the diseases, so that the pharmacist can tell the patient about the importance of what is their disease condition and what has to be taken to cure that disease. without taking the medication, they will what are the severity they will it will cause. He should properly explain everything to the patient. In most of the situation, doctor only give yes prescription. They'll have a dialogue with the patient about the medications and their usage and strategies to incorporate the regimen in the daily routine. In most of the condition, the patient, the provider will give a prescription. They will check the disease diagnose, and then he will write the prescription and dispense, ask the patient to go. They will not explain about, mostly they have no time to explain about everything, each and every medication, how to take it, what is the importance of taking, what are the adverse effects he will cause, what are the major adverse effects, minor adverse effect, what to do if he has a minor adverse effect, if what to do if he has a major adverse effect. This all the doctor will not say that to the patient because they have a lack of time. This is the role of the pharmacist who can explain each and everything to the patient. He should explain each and everything to the patient. Patients are also worried about the adverse effect associated with the medications, which is they also are worried about adverse effects, so that the patient, the pharmacist should explain each of the minor and major adverse effect which will be caused, which can be caused by the medication, and he must explain about what to do if the minor adverse effect is caused and what to do if the major adverse effect is caused. These are the role of the pharmacist. Many research studies have confirmed that pharmacists can play an important role in improving the medication adherence behavior through yes. Many of the research has done, and many of the research has found that the pharmacist played a important role. The counseling given by the pharmacist improved the medication adherence. This is this was done by the research. This was came in a research studies. During the counseling, pharmacists can identify the factors responsible for the non-concurrences. They can ask the patient what is the factors affecting your adherence. What is your opinion? They can ask why do you not you are not taking the medication properly, what you are fear, you have fear about the adverse effect, or you have no knowledge about the disease, or you have no knowledge about the importance of taking medication. What is the main factor which affecting you to stop taking the medication? He can ask the patient, and then the patient will say, right, you should ask them friendly, in a friendly manner. So then the patient will start to say, this is the, so that after hearing this, he or she can explain about the importance, the adverse effects, what to do if the adverse effect caused like that. They can explain. After explaining this, the patient will start to take the medication. If the patient is miss the dose, they unknowingly missing the dose is the major factor of it. Means he can ask the patient to set an alarm. Like that, he can help the patient, so that they will properly follow this, and they will get benefit of taking the medications. Yes, thank you. In this video, what are we have seen is definition. What is meant by the medication adherence? What are the factors affecting? There are bunch of factors. In this, five major factors according to who? social and economic factors. Mostly this is related to the patient situations, economic, like money problems, like that. Next, healthcare system factors is mostly related to the provider and the patient. Next, condition related factor mostly uh, means patient's conditions. Therapy related factors means therapy, like injections, like inhalers, like that. Therapy related. Patient related factors means mostly patient conditions like stress, the anger, like that. Next one is formula. Formula we know percentage of the medication analysis equal actual doses since this appointment divided by total number to be considered in 100. Next one is the main role of the pharmacist in improving the medication adherence. There are several roles in that. The main role is done by a pharmacist himself. Because the pharmacist, the prescriber will not explain about each and everything to the patient. The main role is in here is the pharmacist. The pharmacist should explain each and everything to the patient about their disease condition and the importance of taking the medications, benefits of taking the medication, what will happen if you not take the medications properly, what will happen if you miss the dose, what to do if you miss the dose, what will happen if an adverse effect happen, what to do if an adverse effect happened. These are the like that. Then they can provide support family members to help the patient to take the medications properly. They can encourage the patients to take the medications properly. They can also tell the family members to encourage the patient. They can also tell the family members to help the patient to take the medications properly. These are the role of the pharmacist to play. The pharmacist here should play an important role to improve the medication adherence. And some studies also said that already they have found that the patient counseling by the pharmacist has helped the patient to improve the taking of the medications properly. So, the major role is followed by the pharmacist himself in the medication adherence. This, thank you.